this is the most normal I've felt in 5, 6 years, like a normal
Yes.
human being. And if I can just say, I mentioned this when we jumped on this morning. Um, I was eating low FODMAP, and so as you and I caught up a week or two
Mm.
ago, you're like, "Hey, enjoy some FODMAPs." So I spent a week this past week with my wife out in Zion hiking, and I ate all the FODMAPs you could eat. And in the past, I would have been chugging herbs and still feeling 20%, if you will, of symptoms, and it's still like I'm a normal human again.
Hey everyone, I had a great conversation with Kyle. He is a patient at our office, and I have to say, his story really helps give a portrayal of how important probiotic triple therapy is. In his case, he was on chronic for years antimicrobial therapy to keep his SIBO and corresponding GI symptoms under control. And once we had a chance to advise him, he was able to stop this years long antimicrobials he was dependent upon, see better improvements symptomatically simply by going from one probiotic and starting on the three as we advocate for with probiotic triple therapy. He also had some cardiovascular symptoms that were being driven by oversupplementation of fish oil, which is something I don't think enough people know about. And we'll share a meta-analysis connecting fish oil use to atrial fibrillation. And of course, we'll outline his symptoms and again, how probiotics were really the missing piece to allow him to see his peak level of symptomatic improvement, expand his diet, and not be dependent upon ongoing herbal antimicrobial therapy. And then I guess as we always do, we tie in the mentality piece and how these shifts led him to, as he put it, feel like he wasn't sick and was a normal, healthy person who could, as I'll also share, go on a trip with his wife, have some alcohol, eat off plan, and feel normal, healthy, vital, and strong. So it's a great case. Kyle, thank you for sharing your story. And now we'll go to the chat with him. Hey everyone, this is Dr. Ruscio. I'm here with Kyle, who has had some nice results with working in the clinic. And boy, Kyle, there's so much here that I want to share. But first, before I just jump in all the nerdy details, let me say hello and thanks for joining me today.
Oh, it's my pleasure. Thanks for having me.
Yeah, as I try to, as much as I can and my schedule will permit, share these things that we see in the clinic, wherein we talk about all the academics and what have you on the podcast. But I think embodiment of how these principles can help someone can really allow the healthcare consumer who might be floundering with, well, there's all these different theories and options I have for how to improve, in this case, your gut health, which was also spilling over to some insomnia, some acne, and you were having heart flutters, which is a separate track, which I want to tie to fish oil in a second for people. But
Okay.
I think the cases help people hopefully see a path through some of how they can reconcile and rectify their symptoms. But maybe to kick off, do you want to give people the short of what your symptoms were and kind of the road up until we met?
Oh gosh, yeah, that's a great question. So I'll keep it short. But it was about 5 years ago or so that I had this sudden onset of just all the symptoms, so to speak, from vertigo to insomnia to upset stomach, diarrhea, you name it. It actually came on pretty strong when we were on a vacation skiing, and so I thought I had altitude sickness or something. And then I went and saw like 7 different doctors over the course of a year, and things just continued to get worse and worse. And so, long story short, as you know, I actually met you at a conference, and you gave me a cool little tip on like, it sounds like you're having some issues with histamine. And anyway, that led me down a path of learning about SIBO, and I started doing some SIBO treatment with antimicrobials, and for the most part, that cured like 80% of my symptoms. But I was still having to sort of live on antimicrobials all the time. If I got off of them for too long, I felt horrible. So I thought I had this sort of issue with, I'm going to have recurring SIBO the rest of my life. And anyways, I listened to a podcast with some information from you and got really excited to reach out to you. And here we are today.
And so there was vertigo. I didn't realize there was vertigo also. Is that something that the antimicrobials took care of, or status
yes,
on the vertigo?
they did. Yeah, the vertigo was actually the most cloudy head and mind, and vertigo was actually the most frustrating and profound symptom. That was the one that really dampened my quality of life.
Right.
I did start taking some grass-fed kidney that has, I forget the enzyme for histamine.
DAO. Yeah.
DAO. And that seemed to help pretty quickly, which was a clue for me. But yeah, luckily I haven't had vertigo since the antimicrobials.
Okay. And when you came in, what I have in the chart here, insomnia, flatulence, bloating, acne, and PVCs, this sort of heart flutter. Is that accurate, or anything you would want to add to that? Well, also recurring SIBO, and the desire to eliminate your antimicrobial dependence. So that's kind of a snapshot of walking in. Anything you'd want to add or modify?
I don't think so. It's pretty dead on.
You know, one of the things that we've discussed in the podcast in the past is having a loose treatment hierarchy. And maybe you heard that with some of the podcasting that you would listen to, in terms of, okay, we have a list of all the therapeutics. Let's rank order them from the safest, the most effective, down through more invasive and or potentially more experimental. And this is a derivative partially of clinical experience and partially of what's been published in the research. And in some areas in clinical practice, as I'm sure you know, there's not a lot of data published. So clinicians are just kind of doing the best they can to read the tea leaves and help patients, but they're really just going based upon what they see in clinical practice. There's not this wealth of science to turn to. Thankfully, in the area of GI care, there's a ton of research. I mean, the amount of studies on probiotics is mind-boggling. And that's what I want to kind of bring us over to, is probiotics, because maybe 7 years ago, I would rarely use probiotics. And this was partially because there's a bias in the field, in the integrative alternative medicine field, that you want to use antimicrobials. And part of where this comes from is upstream to that. There is, in my opinion, a way overuse of stool testing. And so you do a stool test, you're going to find something that needs to be killed, right? And so people go right to, as I used to, antimicrobial therapy. But I mentioned a moment ago, we have this sort of rank order list of therapies that evolves over time depending on the research literature. Well, as I've been following said research literature, there are a ton of studies showing that probiotics can clear SIBO and can clear other infections. Whereas there's only 2 studies to date showing that antimicrobial therapy can clear SIBO, and we're about to publish actually the 3rd in existence. And and maybe I'll just pause there and let you comment, because I don't know that enough healthcare providers and certainly enough lay people understand that there are over 22 studies showing that probiotics can clear SIBO, and there's only 2 showing that antimicrobials can clear SIBO. I don't think that that's the impression that you were under, at least before we had chatted, right?
That's right. Yeah. And if I can just say, so before, when my symptoms were at their worst, I was just doing some self-discovery. And in the spirit of being healthy and, trying to live forever, I was eating all the fermented foods and taking all the probiotics, et cetera. And that was making my symptoms, much more worse. And so then when I started going down the path of SIBO, all of the functional doctors, the books and podcasts I could find on it, and I really dove into it, was really just the conventional wisdom was to use antimicrobials. And I did rifaximin, and I felt okay for most of it. And then at the end, symptoms kind of came back on. I did all the antimicrobials. But to your point, the thing that was fascinating is I then sat in that sort of antimicrobial world, being terrified of all probiotics, except for maybe a soil-based one, and for like 3 years.
Right.
So yeah, it wasn't like 2 months of searching and then.
Yeah. And this is where it can be hard to read because fermented foods do contain probiotics, but they're
Right.
also, as I know you know, with the whole histamine backstory, are high in histamine. And so it could be easy to sort of throw the baby out with the bathwater and say fermented foods don't sit well with you. Oh, it's got to be because of the probiotics.
Right.
Usually, as we heal someone's gut, they're more able to tolerate histamine, whether it be just histamine foods natively, like let's say avocado or spinach, or histamine containing foods that are fermented. But the key point is that we want to be careful not to forego such an effective therapy, probiotics, if there is SIBO. So let's give people sort of the backstory. I know you had been working with one of the, I think, better clinics in functional medicine, and your clinician had done a pretty good job of getting you, I believe, to antimicrobials and getting you the SIBO diagnosis. But maybe give us a short snippet on what you have been doing with the other clinic you were working with.
Yeah. And so when we started doing lab work with that clinic, they were pretty convinced I had hyperthyroidism or some issues with my thyroid, like cancer and nodules, because my numbers were just off the chart. And so I went into the hospital and did all the CT scans and the iodine uptake, et cetera. And all the results came back, oh, your thyroid's working perfectly, which is bizarre. I know you specialize in thyroid. And so it's been great because over the last 3 years or so working with that clinician, my thyroid levels have normalized. I feel like we've gotten my gut into a pretty good space as far as the impact on my thyroid levels. And also my iron was off the chart, et cetera. So we've done a lot of great work there. But I actually had a follow up with them a few weeks ago when I was in the middle of my treatment with you. And it was awesome because even in that moment, they're like, oh, I love Ruscio and the Ruscio Institute and sort of the work he's doing, and also really kind of the theory, so to speak, on probiotic treatment. But we've never really tried it, and I'm interested in trying it, but I haven't tried it with myself or any of my patients. And so, sort of to your point, this is, from my perspective, one of the sort of key players in the functional medicine world with a focus on SIBO and gut health, and yet for them, it's still not even really on the radar to move into high dose probiotics.
Right. Well, maybe however you would word it. Yay, right. Maybe this will be the case study. And when this publishes, please send it to your other doctor, because I'm trying to build as much of a bridge as I can. And I think I know where this comes from. There's kind of two camps, I think, with SIBO treatment. One is sort of the Mark Pimentel, Allison Seebecker. And as much as I love Allison and really respect Mark's work, I've noticed a very consistent trend amongst conventional doctors. So Pimentel being a conventional doctor, Allison obviously is a naturopath, but there's just, when you're trying to talk to conventional gastros about probiotics, it's like you're trying to convince them to give patients cyanide. It's incredible the amount of pushback that I get. In fact, I had a conversation with one gastroenterologist. Here's a meta-analysis finding over a 50% clearance rate of SIBO with probiotics. And his reply was, well, what about so-and-so's theory about XYZ? And for those of you who are scientifically inclined, when you have a meta-analysis and then your retort is so-and-so's theory, it is just like, it's like stabbing someone who's science-based in the heart. Like, what are you talking about? So this is why I'm trying to build this bridge, because depending on sort of what camp you're doing most of your education from, you might have that sort of bleed over that, well, we should be really reticent with probiotics, which I'd understand. But we make our opinions not based upon thought leaders, but based upon evidence. I mean, sure, we'll start with a thought leader, but then, as you probably know, I'm a scrupulous fact checker. So, okay, thought leader, let's take your argument, let's dissect it, and let's look at what the evidentiary underpinnings are. And if your underpinnings are a theory, or as we've outlined in the past, there's one very small study in 21 patients that found giving probiotics led to a slight increase in SIBO gas levels with no change in symptoms. That is often cited as the basis. Now, if we were to take a small study in 21 people who took probiotics, had no change in symptoms, and had a slight increase in gas levels, and weigh that against a meta-analysis of over 20 randomized clinical trials that have all cleared SIBO. I mean, I think it's pretty obvious, and correct me if I'm wrong here, but like, which one gives you a much greater confidence in, the levels of the evidence? Am I nerding out too much there, or is
No, not at all.
Okay.
Yeah, totally. And in fact, when I started treating with both the antibiotic and then the antimicrobials, I was doing breath tests for SIBO, and my numbers, as my symptoms went down, my numbers stayed the same or went up. So it actually got to the point where I was like, well, I don't even care about these tests because they're sort of all over the place, and at least I'm feeling better. Which,
welcome to my camp.
Point,
yeah,
sort of, yeah, right. Exactly.
Right.
And I have two close friends. I joke, I'm like, oh my gosh, it's an epidemic. But I have two close friends who, like myself, had bizarre symptoms for a few years and ended up getting diagnosed one way or another with, what everybody's calling SIBO here. And they are like myself in that they've been treating off and on for a year or two now, and still, if they're off the herbs for too long or eat high FODMAPs, their symptoms come back. And so, of course, I'm preaching to them now, oh my gosh, you've got to try this probiotic methodology here.
So let's tie that in. So one of the more compelling things, probably the most compelling thing about your case was, okay, there's this history of antimicrobials help. That's a huge win. Yes. Yeah. If you had stopped for 3 weeks or so, symptoms come crashing back. So you're in this syndrome of needing to go on rotational antimicrobials, which is something I advocate for. I wrote about this in Healthy Gut, Healthy You. But the key thing is that only is used after you've gone through the step that precedes that, which is the use of probiotics. Enter your case. You were on probiotics for roughly, I think it was 6 weeks when we checked in, maybe 6 weeks. You had been off the antimicrobials. So you had been off the antimicrobials for 5 weeks plus. You had a better symptomatic improvement than when on herbal antimicrobials. And you also commented to me that you didn't feel like you were sick in the sense that there was this thing you had to keep treating.
That's right. And it's worth mentioning two things. One, I was taking a soil-based probiotic, and also, I don't know if I can use brand names here, but a really popular feed probiotic. And so in my mind, I was like, well, I'm taking seed, I'm taking a soil-based probiotic, so I'm already taking probiotics. Right. How can they be helpful? And of course, I listened to a podcast of yours that made me more interested. But then when we switched over to the probiotics you have me on, and I don't really understand the differences other than, so you could speak to those if you'd like, the fact that as I was on them, it only took about a week for me to notice, oh my gosh, I don't really have any symptoms. And then when you and I spoke a week or so ago, we were 6 weeks in, like you said, and I think I used the language, like, this is the most normal I've felt in 5-6 years, like a normal human being. And if I can just say, I mentioned this when we jumped on this morning, I was eating low FODMAP. And so as you and I caught up a week or two ago, you're like, hey, enjoy some FODMAPs. So I spent a week this past week with my wife out in Zion hiking, and I ate all the FODMAPs you could eat. And in the past, I would have been chugging herbs and still feeling 20%, if you will, of symptoms. And it's still like I'm a normal human again. So
yes,
it's pretty amazing.
That to me is the most important thing, is that you feel normal, because as someone who's felt abnormal or sick, whatever phrasing we want to use, it's pernicious. Psychologically, it's pernicious, meaning you can't enjoy life because you're thinking about, is there FODMAP in this? Is there nightshade in that? Is there gluten in this? And it's not, that's not how one should have to live if we're doing all these things correctly. And I really believe that the mindset mentality piece is at least 20%. For some people, it might be as much as 40-50%. Like literally in some cases, it can be half the game, because even when they are feeling better, there's still this sort of malware of fear in the background running all the time. And we know that fear correlates with the reactivity of your immune system, meaning it turns it up. So just the fact that you said you're feeling normal is such a huge win. And to come back to your question about how the probiotics are different. So you're on two types of probiotic, the seed being a lactobacillus and bifidobacterium blend, and the soil-based being a soil-based probiotic. I believe your dosage was a little bit on the low side. How many capsules of each were you doing per day? Was it 2?
That's a good question.
Do you recall?
I was taking 2 of the seed and I think 1 soil.
Yeah. Okay. So that's not a bad, entry point dose, but the way we break this down is, so picture you have these 3 different formulas. You have the lactobif, which would be seed. You have the soil-based, and then what you weren't on was a Saccharomyces boulardii, or Boulardii, which is a fungus. So you're on 2, 1, and 0, essentially. And our minimal dose is 2, 2, and 2.
Right.
And I believe we started you on the sticks, which essentially takes 2 capsules from each into a single serving tear stick. And we gave you the recommendation of taking those once or twice per day. So that'd be 2, 2, and 2 once per day. Or if you were doing twice per day, it'd be 2, 2, and 2 twice per day. So the dosage is significantly higher. It's what's been used in the clinical research, but how it differs is this whole theory of triple therapy, which hasn't yet been published. And it's something that we are working on publishing. Hopefully at some point next year, we'll be able to publish this in some sort of, control to intervention setup. But we know that with many different imbalances or infections, more than one, either antimicrobial or antibiotic, works better than one alone. And so that's kind of the same thing that we're doing here. You were on 2 different formulas. One, you're on a really low dose. We got you on 3 formulas at a bit more of a clinically viable dose. And look at the change that you saw. It was just, a really nice exemplification of how powerful this can be.
Yeah, it's brilliant. And it was almost instant for me, a few days. So it's not like, weeks and weeks in, which was incredible.
Right. And there's also data to support this, right? We've discussed on the podcast many times in the past that if you look at meta-analysis data, meaning summaries of clinical trials, so we're going to get a nice aggregation of how effective this is. Rifaximin for clearing SIBO clocks in the 50s in terms of the average clearance rate. Probiotics clock in also in the 50s, meaning you have a roughly like 50-55% chance of clearing SIBO with either rifaximin, the antibiotic, or probiotics, which is great. When you combine them, you get to about an 85% clearance rate. So this is why we recommend starting with probiotics, which in your case, that was enough. Yay, right? If we needed more juice, that's when we can layer a short course of the antimicrobials on top of that. So hence the hierarchy and why we have an order of operations that we recommend working through.
Wow. Did it help that I had done sort of the inverse of that, done antimicrobials for so long and then got on probiotics?
Yeah, probably. I mean, I think just the combination is what's needed. My preference is to use probiotics first because I think they have more carryover benefit than antimicrobials. If you just look at the fact that probiotics can improve mild cognitive impairment, anxiety and depression, issues with skin, non-alcoholic fatty liver disease, can help with certain thyroid markers. It just seems that this would be a better starting point. But in any case, if someone needs more juice, the combination is a good therapy to use, irrespective of how you get there. So in your case, you probably did have some benefit with being front loaded with the antimicrobials.
I must say, I did feel, and I don't know if a lot of people feel this way, but I did sort of feel like, wow, I'm using herbs all the time. And so I'm constantly just killing off bacteria. Yeah. And this may not be very scientific, but moving to probiotics, it felt like, because everything you see that's published right now anywhere is like, you should be taking probiotics for your health, right? And so everybody's selling some sort of probiotic drink or something. And so to have that paradigm of like, I can never have probiotics and I'm constantly killing things did make me, whether it's a fallacy or not, sort of concerned with my long-term health. And then also another piece that I wanted to mention, going back to the friends that, have been dealing with these things, sort of SIBO symptoms. I don't know how often you see this, Dr. Ruscio, but the discouraging thing is if you make progress in your health with the clinician, and then you get to a point where it's sort of like, well, this is the best we can do. This is where we're going to be maybe forever. at least in my experience, it's easy for people to eventually just give up. And then when they give up in many areas of life. Well, why exercise and why focus on my sleep and why
Yeah.
not drink more alcohol, et cetera? Because, nothing works anyways,
Yeah, no,
Yeah.
it's a great point. I mean, coming back to the mentality piece, right? This is why the mentality is so important and why we will interrupt people when they start forming this feeling of a combative relationship with their gut. I've got to kill these things.
Right.
And that's where I think you were. There was always this thing sort of blooming inside of you that you always had to kind of kill and beat down. And that's a very adversarial relationship to have with your body rather than a supportive one. And that can spill over to, well, I'm going to make sure I exercise and I meditate and I do all these other things because I'm in this mentality of supporting my health rather than my body's like rebelling in some weird way. And I got to constantly be attacking it with some sort of, aggressive killing therapy like antimicrobials.
Absolutely. Yeah, I agree.
There's another aspect here that I wanted to tie in, which, I've picked out maybe 2 or 3 cases of this in the past 6 months. And there was a meta-analysis published that found, and this is really surprising to me actually, that fish oil supplementation, while it does have certain benefits, can also lead to an increased risk of atrial fibrillation, which is a pretty clinical condition wherein there's sort of uncontrollable heart fluttering or tachycardia. And so my thinking has been, well, maybe some people would have AFib if the diagnostic workup was robust enough, but their either GP is just saying it's PVCs because they have no further diagnostic data or something like that. And because of that, speculation, could these people with PVCs, these heart flutters, could they also benefit from stopping fish oil supplementation? And so outside of the recommendation for you with the probiotics, I said, why don't you stop the fish oil for a while? Let's see if that impacts your PVCs, your heart flutters. And how did that go?
Great. Yeah. So I was taking a sort of cut the multivitamin that had a high dose fish oil in it. And so I cut those out and my PVCs have been essentially nil. I mean, maybe every once in a while I'll get a few, once a week, et cetera. But for contrast, I mean, I was getting PVCs for hours every single day. And they were just like,
hours. I didn't realize it was for hours. I'll get a short in some cases if I go from too hot in the sauna to too cold in the cold tank. I guess there's this reflex called the diving reflex that leads to a very sudden decrease in your heart rate. And sometimes I'll get flutters. And I can say just for that 10 minutes, it's quite unpleasant. It is something that I've noticed as I condition my way through it, those go away. So I think there's some sort of progressive adaptation. But just to speak to, when you feel like your heart is out of rhythm, it's really dissettling.
It is. It absolutely is. And it also wasn't uncommon. So I wear like an Oura ring, and it wasn't uncommon if I went to bed with a lot of PVCs, and they called them triplets. I went to the hospital actually for them years ago, and you could just watch these sort of triplet beats happening on the screen there. And that my Oura ring would go hours into the night, maybe 2 a.m. before it could actually catch a heart rate or a heartbeat. It would just have this gap. And Oura would be like, we don't really know what the gap's for. Maybe you're sleeping on your hand or something, which from my experience, no, it couldn't read the PVCs, So that's been another game changer just for quality of life, to not be terrified that, at any given moment, something's going to trigger me to just have these flipping heart rates.
Well, that's what I had sort of been forming a backup plan. What do I do if my heart stops? Right. Because that's what I was worried about, with these PVCs, like who would I call and what would my, exit plan be to getting to the hospital as quickly as possible. So it's not a pleasant thing to have to be, ruminating on in the back of your mind.
That's right. Exactly. Yeah. So it must be from my experience so far, some combination of, the only thing we've changed since you and I have been working together is cut out the antimicrobials, cut on the probiotics, and cut out the fish oil. Right. And I would say that I'm essentially symptom free with the and I'm in exercise and do the sauna, et cetera, with the idea that I still get 1 or 2, like I said, maybe for 15 or 20 minutes PVCs once a week or something like that. So
great. And I would anticipate that with additional time, we'll see those fade away. But if not, there's a few other things that I'm also looking into with certain populations, which is a B vitamin protocol. You've probably heard that B vitamin insufficiency can lead to tachycardia. But given how strong the response has been so quickly to the fish oil, you probably just need some time to let your body get to a bit more of a balance. Because as you probably know, the cell membranes will have this fatty acid ratio, and that's going to take time for those cell membranes to turn over.
Yeah, absolutely. Well, I must say, and this may not be the case for anybody listening to this podcast of yours, but it's, when you get on the world of Google and you're looking for PVCs or IBS symptoms or diarrhea or all these things, it's sad that, like I mentioned before in the beginning, I've seen 7 sort of traditional Western doctors. And the outcome from all 7 was, well, this is just normal. You're getting older. Or you have traveler, and I'm 36 years old, right? Traveler's IBS, or and you're going to have it forever. Or PVCs are just, they're benign and most of the population have them. So it's common and you'll just live with them. And my heart goes out for all the people that are like, well, this is just the way it's going to be from now on. And if they only knew, that your body is wanting to get into some homeostasis and back to sort of normal and live optimally. Yeah.
Absolutely. Absolutely. And 2 things I wanted to circle back to. One is just you went away with your wife and you were able to eat whatever and have fun. And for the people watching this, for the clinicians watching this, it's really important that we don't make people think they have to live a more stringent lifestyle than they do. And this is something that took me a long time to learn. Way back when, I was a pretty staunch advocate of the paleo diet, and I was convinced that no one should have gluten, only some people should have dairy, right? This whole sort of thing. And those recommendations are helpful for some people, but so many of the people I think us in functional medicine work with, they're motivated. They're not beating their bodies up with a bunch of crap food. If anything, they need a little bit of license to have some fun. And so, that's a huge box for us to check. And the other thing is sometimes people think that if they've had symptoms for a while, the solution has to be one that's esoteric or new or novel. Maybe Ruscio is going to use anti-biofilm agents. Maybe there's a stubborn biofilm and we got to get really, and I will say this with a very, very large degree of confidence. The more tests your clinician orders, the more complicated your care, the less your clinician understands how to resolve the problem. Because the arc of my use of testing and exotic therapies has been very inverted U. The better I get as a clinician, the more targeted my recommendations are. Look at your case, no testing, and just 2 very strategic recommendations based upon you and your history and also what the science tells us will be helpful. So it's crucially important for me to state this clearly, especially for those of you watching this who may have had kind of a long road and now you're starting to form the belief that we got to really roll up our sleeves and do a lot of testing. This is going to be really hard. That's usually not the case. It's just knowing what are the couple strings or maneuvers we have to make, and then you should start seeing the needle move.
I agree. And the impact is massive because, 2 things from my perspective. What happens over time, I met you at a paleo conference years ago. And I'll say thank you again. You took a few minutes to talk to me and it just set me down the path of healing. But as you know, so many people get into this place where they create these sort of religious, dogmatic eating disorders, if you will, and it separates people socially, it separates families. On one end of the spectrum, it was brilliant this last week to eat whatever I wanted to really eat after years of pretty strict paleo, et cetera, and almost to be expecting, wow, I'm going to pay for this, and to go, oh wow, no, that's the human body's more resilient than that. I'm doing just great. And then on the other end of the spectrum, just to be away from years of my own sort of, wow, I can't believe people eat that way, or I can't believe people don't know the truth, so to speak, about what they need to do. And one more thing, Dr. Ruscio, I don't know if I told you this, but I also tried a lot of obscure treatments, the biofilm, I did this treatment where it was like high dose Pepto-Bismol pills for many days in a row, which I
They're
felt
probably expecting it was
horrible.
sulfur SIBO. Yeah, yeah.
Yes, exactly. And I felt horrible during that time. I don't know if it was just
Yeah.
sort of a placebo thing, but I had more anxiety, more depression during those 2 weeks when I was doing it, et cetera. And it seems to be like the more simple, like you said, the better the cure.
And that's been my experience, with different consultants, whether they be consultants in the business world or financial advisors or a coach I'm working with. Over the years, I've noticed the person that just talks a whole bunch and doesn't really listen, and there's a dizzying amount of information, and it's impressive. But I've learned that, that attorney who talked for 45 minutes and didn't ask me one question about what situation we were actually in, like many people may notice different doctors make the whole, what's the biofilms? And they go on for 20 minutes. Again, try and help people. I don't mean to sound disparaging, but sure. I've learned that those people are so in love with their own hypotheses that they're not spending enough time analyzing if what they're doing is actually working. And that's a derivative of questions, right? Well, what did you do with the last provider? How did that go? What diets have you used? What treatments have you used? And then when we follow up, how are you feeling? And really being controlled in how we intervene. Plus, like I mentioned earlier, looking at what the scientific literature says. And as one example, gluten, as more and more data has come out, we've mentioned this very impressive paper by Levadas, and they found or it was Volta rather, at University of Bologna, they found about a 3% prevalence of non-celiac gluten sensitivity. And estimates range on this, but at the high side, non-celiac gluten sensitivity is about 10% of the population. So then how can we be telling everybody you've got to avoid gluten? Right now, what happens is in so many cases, health educators will say, well, Western countries are depressed or overweight. The metabolic syndrome is rampant. And look at how much more of X we're eating. And they vilify X. And it may not be just X. It may be total calorie consumption, hyperpalatable processed foods, right? Less time moving, more time being sedentary, less community, less happiness. And so when we take one thing and blame all of the problems on that one thing, and then we sort of put people into what I like to call these dietary prisons, it doesn't tend to help a lot of them. I mean, sure, the person who is eating a hellacious standard American diet, they probably need to hear a little bit of that. But again, coming to people like you who are educated and proactive, we want to give you the guidelines so that you can say, okay, I understand the prevalence of non-celiac gluten sensitivity. Let me go have gluten and see how I feel. And then, like we also say, your body is boss. If you get strong pushback, okay, let's heed that warning. Let's heed that biofeedback. But if you don't, then be able to be the guy out at dinner with your wife who's not berating the waiter about if the breadcrumbs in the chicken parmesan or whatever, contain gluten.
Yeah. Or for the longest time, I wouldn't eat any seed oil. So it's like, oh, is your olive oil really olive oil or is it canola oil? And I always laugh if you go to all, after years of reading all the books and going to all the conventions and all these things, if you follow all the recommendations, you'll eat nothing and probably starve to death. And you'll spend a lot of money on all these the other thing I think that's worth mentioning, and I don't know how many of your followers fall in this category, but sort of this biohacking, I don't even really know what that means, world where there is I spent thousands of dollars on deuterium water and hydrogen water and all these things because they were going to be the miracle that solved everything at a molecular level in the mitochondria, blah, blah, blah. And over time, I find it silly. It's like the Dunning-Kruger effect, you become an expert really quick and everything's bad. And then later on, you're like, oh, this is getting a little ridiculous and sort of silly.
Yeah. Exactly. And we now have you off the paleo low FODMAP diet, and we're recommending what we call the nutrient dense diet, which is just a very sort of open focus on nutrient dense, non-processed foods, getting some organ meats, getting some fermented foods, making sure some of the big things that people miss out on aren't overlooked. But otherwise, it's a pretty broad diet in which you could be, higher carb, lower fat. You could be lower fat, higher carb, really to kind of what suits you. And I'm looking in your chart right now, and I made a note: consume alcohol as you wish. knowing that because some people they'll say, well, I have 2 or 3 glasses of wine per night. Okay, that's probably too much, right? And in those cases, it's a different conversation. But in your case, reading the person in front of you, asking questions, listening, getting to know them, you were more so the other side of the spectrum, which was, I don't think you were enjoying your life enough. And so now we need to take some of the guardrails away and let you live a little bit.
Yeah, absolutely. I agree.
Well, I think we went through everything there, fairly thoroughly. I don't think we're out of the woods yet, but I think we're pretty much there. There's a couple little things we'll want to tweak and monitor. But overall, I guess actually, yeah, we're pretty much coming out of the woods now. But anything you want to sort of leave people with or mention and close?
Oh gosh. No, I just want to thank you for your work, and I want to give people hope. I mean, continue to learn. And I think I was on a million vitamins and different things like that too. And now my dosage of most things, I don't know if you mentioned this, but you took me off a lot of stuff. Like, hey, you can stop taking this. And that's costly. And I sent the paperwork to you. I did an in-depth blood analysis a few weeks ago and through Inside Tracker, and it was like everything was almost sort of perfect. And again, it's sort of like go back to the basics, get some sleep, listen to your body, eat whole foods, and if you've got sort of this moment of dysbiosis, mine all started from this really bad sickness when I went to the Dominican Republic. And so if you come into this moment where you need to do some stuff, I just want to say there's hope that you don't have some lasting disease the rest of your life. Now you really can get back to the basics with sleep and exercise and good nutrition, et cetera. So your work's been profound, and I appreciate you at the conference 4 years ago taking the time to talk to me and being my physician now and having me on here to help spread this testimony, and hopefully some people will connect with it, with their experience.
Absolutely. I mean, I know they will, because this is a common thing people struggle with, especially with the probiotics, and just a whole cornucopia of nice pearls in there for people. So Kyle, been a pleasure working with you. I'm glad we connected at PaleoFX, and thank you again for sharing your story.
Thank you, Dr. Ruscio.